The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Cindy Tyler. I'm the Director of Membership Development for the Florida Medical Association. And I just want to welcome you all and thank you for your interest in learning more about training and certifications we are offering through our partner, FMA Approved. As you are aware, the FMA's mission is to help physicians practice medicine, and to accomplish this, we offer a variety of member benefits which include advocacy, education, reimbursement assistance, and discounts on products and services through our preferred vendor programs. I wanted to just call quick special attention to one of the services that we offer, and that is our medical economics assistance. As most of you are either physicians or office staff in a physician's office, many of our members take advantage of this service, and that is basically we have certified coding and reimbursement specialists on staff that if you have any issues with a claim or an issue with being reimbursed by any of the carriers, Medicaid, Medicare, we can certainly help resolve those issues, and that's just one of the benefits that we offer to our members. Another area that we give our members great value is in our discount programs. We offer, again, a variety of products and services to insurance, debt collection, legal, financial, professional, educational, and offer discounts to our members for these various products and services. And that actually brings me to why we're all here today. The FMA has partnered with FMA Approved to offer training and certifications to physicians and their office staff in the areas of HIT, EHR, and HIPAA. And we've got FMA Approved with us today, and they're going to talk in a little more detail about what these courses offer and how to go about moving forward with them. So if you have any questions at all, please don't hesitate to contact us, and we, again, appreciate your interest in this offering and hope you find it valuable.
Thank you, Cindy. My name is Brian Johnson. I'm the Senior Director of Online Training and Education for FMA Approved, and I'm going to just give you a quick bit of an overview of the training programs we offer, the benefits we can bring to you. I just want to say, first of all, that it's an honor to be with you today and to be a partner with the Florida Medical Association. So thank you for joining us. Again, just a housekeeping note. If you have any questions that you'd like to ask of me or of your FMA representatives, you can go ahead and enter those into the chat area at any time. And at the end of this overview, we'll go ahead and address those questions. We'll also send out written answers to those questions if they're technical in nature or just to give you a nice follow-up. And we're recording this session, so we will follow up with the slides if you're interested in them, and we'll also give you a link to a video version of this event. So don't worry about keeping up. We'll send you a review copy. So I'd like to begin by just giving you a little bit of background about FMA Approved, and then I'll get into our training program. So a brief introduction. FMA Approved was founded in December 2010, and this was immediately after the passage of the High-Tech Act, and which was part of the Stimulus Act, which really changed the landscape for HIT and EHR. So the company was founded to address the growing need in the medical community for an unbiased and trustworthy source of information about EHR and HIT. The company provides free access to an agnostic knowledge base for all medical community end users, and we also offer reasonably priced training and certification programs. And all of our training is online, which is something I'm going to go into in much more detail. So it's very convenient for you, and we really think that this is the future of training. FMA Approved is a recognized leader in EHR, HIT, and HIPAA education, and we believe that our education programs can deliver a great deal of value to FMA members. So that's why we're here today. Why would someone need FMA training? Well, there's a number of reasons you can see on your screen there. One of the major draws that we have for clinicians and providers is that we can help a practice meet its compliance needs. Everyone in healthcare needs to be HIPAA compliant, and HIPAA's been around for a while. It was passed in 1996, but it's changed a great deal since it was first passed, largely because of the High-Tech Act of 2009. That really changed the standards. It expanded who's covered, for instance. It also stepped up compliance. So the regulations have become more complex, and at the same time, HHS has stepped up enforcement efforts. So it's vital that practices meet their HIPAA training obligations, and we can help you meet those obligations. Another area we can help a practice with is in increasing revenue. Our newest course provides comprehensive training on meaningful use. Meaningful use is the incentive program from CMS that incentivizes providers and hospitals to meaningfully use their EHR systems. Whether you're just getting started with stage 1 of meaningful use or you're preparing for the rollout of stage 2 in 2014, our training provides all the guidance you need to successfully attest and earn the incentives from CMS. And I'll talk about both of those programs in a little bit more detail momentarily. We can also improve your efficiency through our courses on EHR and HIT, help staff earn CEUs and grow their skills, and provide a one-stop shop for meeting your HIT needs. So what is ForMed training? Our training has been developed in partnership with industry leaders. So a typical example is our HIPAA training was developed closely with Mike Simmel. He's one of the top HIPAA experts in the country, and it's been fully updated in compliance with the HITECH Act and with the 2013 final omnibus rule, if that's not too much of a mouth twister for you, that was issued in January, that comes into effect in September. So Mike Simmel is truly one of the top HIPAA experts in the country, and we developed that course with him. So it's the best information you can get on HIPAA out there, and all of our courses have been developed with top experts, and they're thoroughly researched. Our education programs are convenient because they're entirely online and self-paced, and that's something I'm going to describe a bit more in a moment. There's no longer any need to send staff off to boot camps, which has been the model for a lot of training around HIPAA and EHR. Now you can get your training entirely online, and that's much more convenient. It saves you time and it saves you money. Our training is recognized by professional employment agencies such as Health IT Central, and it has been accredited for nursing CEUs by the ANCC and continuing education units by IACET. So let's get into a little bit of detail about how the training actually works. As I said before, our training is entirely online. It's done through a learning system. So when you register for one of the courses, the system will send you a login invitation with a link. You click on the link, it takes you to the learning system. You create a password and a profile if you wish, and then you can log into that system at any time you like. It could be 2 in the morning, it could be 2 in the afternoon. It's completely on your own schedule. And how the education works, it's a very rigorous method. We use what we call the 10-10-10 method. So each of our courses, let's say a course is typically 15 to 25 modules, depending on how in-depth it is. Some of the HIPAA workforce training that I'll describe in a moment is a little bit shorter because it's supposed to be very focused for members of the workforce. But for a typical course, you might have 15 modules. Each of those modules is made up of 3 elements. The first element is a 10-minute reading module. So that's typically about 1,000 words that someone can read through and learn about that particular subject. Then the same content is covered in a 10-minute video-audio review. This is sort of like an animated slideshow. It's actually with full-motion video, and then there's bullet points above it. And that gives people another way to get at the same information. Some people prefer to simply learn through text. Others learn a little bit better through video. And so we offer both of those approaches. And then at the end of the module, there's a 10-question review quiz that is designed to maximize retention. So there's not stumper questions in that quiz. It's basically to go over the material in the text lesson and in the video to ensure that you've actually retained all of that information and understood it correctly. Students move through the modules. At the end of the modules, there's a final exam that draws on the quiz questions. And so this learning method has been accredited, as I said before, by those organizations, but it's also, research shows that this sort of immediate review of material maximizes retention. And it's also more rigorous than a lot of the online education you see on the market today, where you might have basically just a slideshow that someone's supposed to move through, and that does not really get to the level of detail and rigor that our courses offer. So I want to just briefly go through the courses. I'm not going to go into too much detail, but I'd invite you to ask questions if you have them. But just to give you an idea of what we do offer and what might be useful to your practice. So let's begin with HIPAA training compliance. This is probably our most popular bundle of courses. And there's two different levels of it, basically because HIPAA itself requires two different levels of training. Now, as you may know, HIPAA actually does explicitly require that anyone who comes into contact with protected health information, or PHI, has to receive HIPAA training on at least an annual basis. So there's an additional requirement as well, which is that every practice has to have at least one designated security officer. And the security officer is someone who has a greater depth of training on HIPAA and also is then responsible for ensuring that the practice is meeting its HIPAA obligations. So our higher level HIPAA training course is called Certified HIPAA Security Professional, or CHSP, and that is probably our single best or most popular course simply because there is so much demand for good HIPAA training right now. So this course is fully up to date through the 2013 Omnibus Final Rule. So HIPAA, as I said before, was passed in '96, but it's been updated a number of times. And this Omnibus Final Rule is the final set of regulations that basically brings HIPAA to completion. And most of the changes weren't of great import to practices, except for the fact that there's a lot of changes to the relationship with business associates. So business associates under HIPAA, most providers would be, with very rare exceptions, are covered entities under the law. If you have relationships with vendors and other organizations where they come into contact with your PHI in any way, those organizations are considered business associates. So there's new rules about business associates and the agreements that you need to have with them. So the course covers the privacy rule, the security rule, and the ways that the HITECH Act changed HIPAA. It describes audits and breaches, your requirements for training and awareness programs. It has guidance on policies and procedures. It also addresses regulatory complexity because states have different rules often around HIPAA than the federal rules. States can't make their requirements less rigorous, but they can make them more rigorous, and many states do. Often that has to do with things like how quickly you have to report a breach. It has best standards or best practices for how you should handle IT hardware, how you meet the security rule specifications, why you should encrypt your PHI. And then one of the value adds in there that is very popular with people is as I was saying before, if you have, let's say you have an MSP, a managed service provider who comes into your practice and provides IT support, HIPAA requires you to have what's called a business associate agreement with that organization. And these agreements are, they need to be updated in light of the Omnibus Final Rule. We have provided you with a template of a business associate agreement, as well as a version that's for business associates themselves. That we can't provide you legal advice. You should certainly, if you have concerns around it, have your own attorneys review that material. But it basically gets you 90% to the finish line on those BAAs if you don't have one ready. So that's a real value add to that course. Now, not everyone needs that level of detail. That's really for a practice manager, or perhaps the physician who handles this in the practice, or for larger organizations that may have an actual compliance officer, it's for them. But again, under HIPAA requirements, you need to designate a security officer either way. But for frontline staff and clinicians who don't need that level of detail, we also offer a certified workforce staff course called HWC. That's shorter, considerably shorter. It's our shortest course. It should take about 2 hours to complete. It's very focused on what you need to know at a pragmatic level. So it has a lot of guidance, for instance, on passwords and how to avoid having a breach through a phishing email, and just best practices that everyone in a practice or a healthcare organization should follow to make sure that they meet their HIPAA obligations. It's also priced for educating an entire workforce, so it's our cheapest offering, and it has volume discounts depending on how many people you need to educate. And the other thing is that at the end of it, you get a certificate of completion that you can put in personnel files, so that if, you know, this would be horrible, but if you were to be audited, they are HHS, it's the Office for Civil Rights, and HHS has really stepped up auditing of practices, and you need to be able to demonstrate that everyone in your practice has gotten their HIPAA training, because that is a requirement, and people have been fined for not being able to document their HIPAA training. So not only do we give you that you can keep for your own records, but through our learning management system, we also have we track that permanently in our system, so that even if you were to lose the record or something, if something were to happen, we could go back and demonstrate that your staff did take that training. And another feature of our LMS I want to mention, this goes for HIPAA, but it goes for everything else as well. If you do have staff that are moving through courses, we can assign you to a team and make one of your staff a team leader in our system. And so then you can track the completion of your staff module by module. We use a learning standard called SCORM. It's industry standard for online learning. And what that allows us to do, among other things, is track completion module by module. So not only can you meet your training needs, but you can go in and look and see that staff member A has gone 30% through the course, and then if you need to, you can go through and say, hey, you really need to finish that course. So that's another nice feature. We also offer a number of courses around EHR and HIT training. So the one I mentioned before is it's new, but it's already becoming one of our more popular courses. There's been a great deal of interest in it, and that's our Certified Meaningful Use Professional course, or CMUP. This is a very comprehensive course on meaningful use. So it's training on attestation and compliance. As you may know, CMS has also begun to audit people for their meaningful use attestation. So when the program began in 2010, I believe was the first year of it, there really weren't audits, and so people could go to the CMS website and attest, and it was basically on the honor system. That is no longer the case. I believe they've stated a goal of 10% of all meaningful use submissions will be audited. I don't know if they're actually to that level, but we have heard quite an uptick in activity around those audits. But the upside of it, I mean, that's sort of the thing you don't want to have happen, but the upside of it is, of course, is that CMS offers valuable incentives for adopting EHRs. And so many practices have moved in that direction because of those incentives. Now there's quite a bit of variety in where people are. Some people are just getting started, and so you always start with stage 1 of meaningful use. Stage 2 for practices that are ready for stage 2, that begins in 2014. And so we've provided comprehensive education on the requirements for both of those stages. If you're familiar with meaningful use, there are what are called core objectives, and then there's menu objectives, and you have to meet all of the core objectives and some of the menu objectives, and there's exclusions, but you have to qualify for them. So it's fairly complex, and we run through all of that for you in great detail so that it gives you the guidance you need. For our audience today, you're probably most interested in the requirements for eligible professionals, but we also have the requirements for eligible hospitals. They're very similar, but there are some differences. In addition to the core and menu objectives, there are other elements that are important to meaningful use, especially the CQMs, or clinical quality measures. Those are fairly complex, and we go through all of those for you for both stage 1 and stage 2 and describe what's required. Meaningful use also requires HIPAA compliance, and that's an area that's tripped people up because it actually requires risk analysis. In the early days, I think some people thought that if they just got the right kind of EHR system that they were then HIPAA compliant, but that's not the case. And so we go into detail about what the HIPAA requirements actually are. We also have a module about health information exchange and interoperability, which is becoming increasingly important. And we give you just a few hints about what's coming for stage 3, although that doesn't roll out until 2016. And finally, we end with an action plan for how you can evaluate where your practice is and then successfully attest for those incentive payments. Another course we have in this realm is a much shorter course called Certified EHR Office Professional, or CEOP. It's really designed for people who don't need a real depth of understanding about the EHR system. This might be the front office staff or someone who's a clinician but doesn't need to get into the nuts and bolts of it too much. And so it's a relatively short course that goes through how the EHR works, how it integrates with other technologies such as imaging and that sort of thing. And it also, one of the things that really makes this course stand out from other courses that are similar to this is that we offer access to a live certified EHR. So part of this training is that you go in to a workflow exercise session where you actually connect to a live EHR and can move through these exercises, and it's not a simulation. So one of our slogans is educate, don't simulate, because a lot of the training that's out there is strictly a simulation. It's not really an EHR, so it only gives you a limited sense of how they really work. This has a mock-up for integration with an e-pharmacy, for instance, and labs, and so you can go through and really see how the EHR works. Now, there's something north of 600 different EHR systems, so this is one in particular, but we chose it because it has a very typical workflow, and it's basically, an analogy we like to use is that it's kind of like going to driver's school. When you go to driver's school, you don't necessarily drive the car that you're going to drive for most of your, or for the coming years, but that doesn't matter very much because what you're doing is learning how to drive, not learning how to drive a Buick. And so because this is a very typical EHR, it really helps you understand how the workflow works, and then if you're using a different system, it'll be very similar to it. So that's a real unique feature that we offer in this course, and a number of the others, as I'll mention here. Some of our other EHR and HIT training courses, one of the other popular courses we have is the Certified EHR Management Professional course, or CEMP. That course also employs the live certified EHR for those workflow sessions, and it includes some of the materials that are in that CEOP course to just provide an introduction to EHR, but it also goes into a great deal of depth in EHR project management, how to implement an EHR. Now, it's not designed from a technical perspective, although it does include some technical knowledge, but it's really designed for that project management role, or if you're the person in your practice who's going to be overseeing the EHR adoption process, this course is ideal for you. It will go through and guide you through how to, for instance, recruit an EHR champion, which is studies have found that that's an important role to have. That's someone in the practice who's a clinician who can actually become, in many ways, a liaison between the technical team that's taking care of the technical side of things and then the clinicians themselves who are having to learn the system. It provides an overview of major market players in EHR, some of the differences between the major systems. It helps you learn technical standards and has a wealth of information about EHR. Our next course I want to mention is the Certified Healthcare Technology Professional course, or CHTP. This course provides comprehensive training for IT specialists in HIT, so it's our most technical course. It's really designed for people who already have IT expertise but haven't worked in the health IT space. So this includes some of the same elements as the other EHR courses, including access to that live certified EHR, but it also includes advanced classes on technical standards and infrastructure, implementation, and some of the standards like HL7 that you need to know to successfully set up an EHR. Finally, I just want to mention two courses that may not be of much interest to some of our listeners, but I want to mention them, and that's our HIT hiring and sales courses. The hiring courses are really designed for people who work in either recruitment or in the HR role, so that may be of interest to some of our providers in the audience. So that discusses HIT employment models, frequently recruited positions, contracts, and more. Then the sales professional is basically an introduction for people who are in the sales space on how healthcare works and some of the organizational issues. Briefly, I want to mention some of the courses that we have on the horizon. These are actually very close to execution now. As you may know, ICD-10 is coming, and many people are nervous about that for good reason. It's much more complex than ICD-9. The rollout is October 2014, and we have it on pretty good authority that CMS is not going to delay the rollout of ICD-10. Sometimes they do give people a little bit of extra breathing room, but they've published this for some time, and the word is that this is going to go live in October 2014. And so it is in the next 3 to 6 months, you really need to get serious about bringing staff up to speed on ICD-10. Part of the complexity of it is that there's something like a tripling or quadrupling of codes, so there's going to be 60,000 plus billing codes. They're not doing that to be cruel, but rather to improve the gathering of information that is done through these codes. But it does require more judgment and more education on the part of the coder or the clinician who's entering those codes. So we say avoid coding chaos and rejected claims. There is the anticipation that when ICD-10 does go live, that there's probably going to be a couple of months of difficulty as claims are rejected for not meeting the new standards. So we'll have a version of this course that's designed for coders and then a version designed for clinicians. So that will be available soon through our partnership with FMA. And that course, we expect that course to be very popular. Another course that we're very close to launching, and it's actually two related courses that somewhat mirror the HIPAA courses, and that's PCI DSS and credit card security. And this may be unfamiliar to many people who work in healthcare. PCI DSS is the Payment Card Industry Data Security Standard. It's a very attractive name there. But what it is this isn't a legal requirement. This is something that the credit card industry has set as rules to be eligible to use credit cards for transactions. And so these are security rules that I said they're similar in many ways to the technical standards of HIPAA. But so there's no legal sanction if you don't meet the PCI DSS requirements, but you can lose the privilege, I guess you could say, of actually being able to use credit cards. And so we feel that this is a major area where many people in the healthcare space may not be aware of the requirements and may not be up to speed on them. And so we partnered with a major education company in this space to bring this course to you. There's two levels of course. One is for that compliance officer who's in charge of making sure that you meet your security requirements. And then there's a much shorter course that's just designed for anyone who handles credit cards, and it does things like, why you can't write down credit cards on a Post-it note and, keep it next to your monitor, as people sometimes do, why that's a violation of those standards. So we think that those courses will be valuable for people, especially because it's related to the EHR. In many smaller practices, it may have been the case in the past that you just had one of those little units and swipe the card and then that was the end of it, whereas now that payment information may be part of a larger computer system. And so as you meet your HIPAA requirements to prevent breaches of that information stored in the EHR, the PHI, you also need to make sure that you're meeting your requirements to protect that credit card information as well. So I tried to run through that quickly because I wanted to save plenty of time for questions from the audience. But I'd be happy to answer questions, and I know that our representatives from FMA are on the line as well. So you can see the contact information there on your screen. You can contact any of us. I realize that we didn't put contact information for Formed Approved on there, but I'll give that to you as well. You can certainly contact me. My name is Brian Johnson at b.johnson@formedapproved.com. And so you can see on the left side of the screen there the way that this storefront works. You can go into the storefront and learn about any of the courses by selecting the categories there. If you go into those categories, you can see the courses themselves and get a breakdown on module per module, what the courses consist of, and learn about the CEU information, for instance. And if the course seems like it's a good fit for you, you can purchase right there using a credit card. You can use the code that we've established for the Florida Medical Association, which gives you a 20% discount off the retail rate. And then if you see in the top right there, there's a login to courses. So when you purchase the course, the system will automatically send you an email saying, thank you for signing up for the course. Here's your receipt. And you can begin by clicking on this link. So you can begin immediately and then go through the course, as I said before, on your own schedule. So I want to right away just thank you for joining us today. And then let's leave some time for questions of either me or the FMA representatives who are here. So Cindy, are you still with us?
Yes, I am. I'm here with Melissa Carter.
All right. Well, at this point, we've got just a couple of questions that are from me, so I'm going to go ahead and address those. And I would invite our audience to go ahead and ask questions if they have them. So the first question is, how long does it take to take the courses? And that's a good question. It varies depending on what the course is. So, for instance, the Meaningful Use course is 9.5 hours. And that's for, when I say that, that is how it's been evaluated by the credentialing agencies. So if you move quickly, you might get through it in less time than that. If you go through and review the modules several times, you might take a little longer than that. I want to mention as well that I didn't mention this before, that when you buy one of these courses, you have access to those course materials for a year. So, for instance, for the Meaningful Use course, you might, want to have that available to you as you move through the process of a testing, and so you have access to the materials for an entire year. Now, some of the courses are a little shorter, as I mentioned. The Workforce course takes about 2 hours. That's the HIPAA Workforce course. The longest courses are the CEMP, that's the EHR Project Management course, and the CHTP, that's the Technical IT course. And those courses run about 20 hours, 20 to 25 hours. The CHSP for HIPAA, the Security Officer Training, runs about the same length as the Meaningful Use. It's about 9 hours. So the courses are designed to be pragmatic, to give you the information you need, and not to lead you on a 40-hour course that you don't need all of that information. So another question we have is, can more than one person take the course? And that is certainly the case. I don't completely understand the question, but if you have people in your practice multiple people who need to take multiple courses, that's not a problem. For those HIPAA Workforce bundles, those are bundled to provide volume discounts, and because you're going to need to train everyone in your course, in your practice, and so for those, we can either sign you up individually through the website, or there's contact information where you can reach us, and we'll take your payment information and then send you a spreadsheet where you can have multiple people moving through that Workforce bundle at the same time. And as I said before, you can go ahead and monitor the progress of your staff as they move through the course. All right, we've got several questions now. Okay, this is a related question, I think, to the last one. Can I buy a course and use it for all my employees, or one course per person? Well, it would depend basically on how you're using the course. Obviously, we would, if you want to get the certifications that come out of it, because each course culminates in a final exam. So, for example, for the Meaningful Use course, there's 60 questions at the end of that, and you have an hour to take those questions, or to finish that final exam. And then at the end of that, you're issued a certification that shows that you have that Meaningful Use training. So each person who buys a course is assigned a unique username. And so to get that certification, you would need to buy each individual a course. But to be honest, if you just wanted to give people the information, you could buy a course and everyone share a login and get that information. Now, you definitely do not want to do that for HIPAA. And the reason why is that because you're required to have that HIPAA training, you need to be able to prove that everyone in the organization got that HIPAA training. And so that would sort of sabotage the purpose of that if you did it. But if you wanted to buy a single license to an EHR course and one person is going to get the certification and the rest just want to learn more about it, you could certainly do that. Okay, so there's a question about cost. So Our courses retail, and there's an exception, which is the HIPAA workforce, which I'll describe in a moment. But the rest of our courses retail for $449 a license. But as you can see, we're offering a discount for FMA members of 20%. So then they're about $359. I believe it comes to $359.20. So the question is, how much does the HIPAA training program cost for the security officer and then for a staff of 85 people? So for the security officer, if you were just buying one of those, that would be a $359 course. And then for the staff, it's a much lower cost for that. So for 85 people, I'm trying to remember exactly where the volume breaks are, but I believe it would be $25 a license. So I'm not going to do that math in my head, but you can figure out 85 times 25. So there is a cost associated with training your staff, but on the other hand, it's really rigorous training and it lets you track that completion, so then you know that you've met your HIPAA obligations. So that's the only course that isn't priced. The rest is the others. This is a great question. Okay, this question is, has anyone been audited by CMS that has this certification, and did it protect them from being fined? To my knowledge, no. I would certainly hope that if someone had been audited who'd taken the course, we would hear about it. I have not heard that so far. As you know, there's hundreds of thousands of healthcare providers, and even if CMS is, or in this case, HIPAA is actually not, the audits aren't from CMS. The audits there are from the Office for Civil Rights, that's the OCR, which is another part of HHS. So we have not heard of anyone being audited, and there's different elements that go into a HIPAA audit. There's two different things that can happen, basically. You can be audited, which is just sort of like, you know, being audited by the IRS, like, it's not your lucky day, we're just going to make sure you've met your obligations. And then they're going to look at a number of things. They're going to look at whether you've ever done a security analysis. That has to be done once by every practice. They're going to look at whether you have an awareness program. You're required to have that. And that's basically just as simple as, are there reminders to people that they need to be HIPAA compliant? But then a major part of it is, do you have a training program, and is the training program adequate? And so because we've developed this in association with one of the top HIPAA experts in the country who has worked on many audits, and the other element that I forgot to come back to is that then there's breach investigations. So you might just be audited, but then if you mishandle or have a data breach, if someone penetrates your network, or the thing that's happening with unfortunate frequency is people are taking PHI on their laptops, and then they go home and they stop at the store and somebody breaks into their car and they steal the laptop, and they might have 1,000 health records in there. If that were to happen, there's things you can do to protect yourself. So the HITECH Act has a specific exemption for encrypted data. So if you've encrypted that data, you don't even have to report it to HHS. It's as if it never happened. But the flip side of it is that if you haven't encrypted that data, it's not a matter of showing that anyone ever even accessed it. The loss of the laptop constitutes a breach in and of itself, and that has to be reported to HHS. And if there's more than 500 records involved, they put you on their so-called wall of shame, where you're required to publicize it. They publicize it, which is supposed to be a shaming element of it. And then in addition to that, you may accrue fines for the violation. So I can tell you that these courses were designed with audits and breach investigations in mind. They're supposed to prevent breaches. They're supposed to demonstrate that training compliance in case of an audit, and that comes from one of the top HIPAA experts in the country. And then I can tell you as well that organizations have received significant fines for not demonstrating training compliance. So some of the fines that have come out, I mean, we're talking about fines in the neighborhood of $200,000, $400,000. The cap for civil fines for HIPAA violations is $1.5 million. So these are significant fines. HHS has really stepped up enforcement. They've gotten very serious about people making sure that they meet their HIPAA obligations, and they have fined organizations for not demonstrating training compliance. So, you know, whether it's through us or someone else, you really do need to demonstrate that you have done HIPAA training for all of your staff. Let me ask another question from our audience. Which course would be necessary for teaching or consulting other physicians in using EHR? Okay, it would depend on how you're doing it. Excuse me, my throat got a little dry there for a moment. So obviously, if you're doing anything around meaningful use, that would be the course for you to take. If you're just trying to provide an introduction to EHR, the CEOP course, that's the Certified EHR Office Professional course, would probably be the one that you want, because especially if it's someone who's never even seen an EHR or hasn't used it, that course is really a basic introduction. It gives you that workflow that you can really get your hands dirty with it. Now, if you're training other people, the course you probably need to take would be the CEMP. That's the project management course, because it's going to give you the depth of understanding that's involved. So you're going to understand more about how the implementation works. It's not the technical course, but it gets into more detail about infrastructure and how these things work. So it would depend basically on what the focus of that training would be. But we offer a variety of options, as you just heard, for how you could go ahead and learn what you need to know to pass on that information to other members of the staff. We have another question here. What if I don't pass the quizzes? If you don't pass the quizzes, then that's not a problem. You just take them over. You can take the quizzes as many times as you want. You can access the modules as many times as you want. So the quizzes are not designed to test you so much as they're designed to help you learn. Sometimes I found in my own experience that if I'm going through something, and sort of skim reading it, I think I've understood it, but then if someone says, well, describe it, I can't do it, and I realized that I wasn't really paying attention. And so that's sort of the idea behind this, is that if you take that quiz, it will actually show whether you do understand the material. And then at the end of the course, there's the final exam. We allow people to take the final exam 2 times. You have to get a score of 80% to pass the final exam. Now, the final exam is rigorous, but it's not designed to be, we don't want a bell curve here. If you take the course and pay attention, everyone should be able to pass the final exam. And indeed, in the vast majority of cases, everyone does pass the final exam. But the reason why we let people take it twice is because it isn't that unusual for people to kind of rush through and then take the final exam and fail the first time. And then that is kind of a wake-up call that you need to go back and review the materials. Take the quizzes again, because the final exam questions are drawn from the quizzes, and so then you have a second chance to pass that final exam. But to be accredited, you can't just let people take the final exam over and over again, so there is a limit. But again, it's very, very rare that people don't pass the final exam if they go through the course and pay attention. Here's another question for you, for me, I believe. Okay, this is a longer one. Would these certificates take the place of our practice having to spend big bucks on a consultant to do the risk analysis awareness training program for us? We've been getting quotes for the risk analysis, etc., and it's several $1,000s for a practice our size, and you have to pay annually, to review and maintain your compliance. The answer is to some extent. Now, what it can't do, and I want to be careful to answer this in the right way, it cannot take the place of that security risk analysis. HIPAA requires every practice to get a security risk analysis one time, at least once. And meaningful use requires the same thing. So this is something that every practice needs to do, and there's different elements of that risk analysis. Part of it is a network vulnerability test. And that's a very technical thing. So that is someone who's an IT specialist going into your system, going into your network and your IT infrastructure, and making sure that you have things like a firewall set up. So, for example, OCR has fined organizations for not having a firewall. I won't mention the university that just got fined for that, but they hadn't set up a firewall, and so when they had a breach, OCR went in and fined them for it. So that takes care of that piece. Then there's also people don't always realize that about half of the security rule standards in HIPAA are actually administrative safeguards. They're not things like network vulnerability. They're things like, do you have security policies in place? do you have adequate procedures in place? So that is part of it as well. And so the risk analysis is going through and making sure that all of those elements are in place. They should make sure, for instance, that you have proper physical safeguards, or a small but important part of HIPAA. You know, do you have locks on things that have to be locked? That's a one-time event that every practice needs to do. So the second part of the question is, you have to pay annually to review and maintain your compliance. Well, I'd have to see more details to know exactly what's involved there, but it's not the case that you have to get, for instance, a risk analysis every year. That is not true. And so generally, once you've had that risk analysis once, you need to then go through and have annual training, and you need to have an active awareness program, which again can be as simple as just having reminders around the office that say, hey, HIPAA is important, you know, you need to do this, you need to, you know, not write your password on a Post-it note and leave it out where someone could grab it. But you don't have to have a security risk analysis every year. And so that one-time security risk analysis is not going to be covered by the training. But then after that, you can meet all of your HIPAA requirements simply by continuing that training after you've gotten your policies and procedures in place. You are required to have at least annual training for all staff who come into contact with PHI to meet your HIPAA training obligations, and these courses meet that obligation. All right, well, I don't see any other questions. If there's anyone in the audience who has other questions, we'd be happy to answer them. You can also contact us. The information on your screen, contact your FMA representatives. Oh, we've got another one here. I'm currently the EHR manager. Which course would you recommend? Well, it would depend on what your level of expertise is. If you're the course that immediately jumps to the top of the list is the project management course. That's the CENP course. If you already have a lot of education in EHR, you may not need that course. It may be more useful to you to go to the meaningful use course, especially since the stage 2 requirements are about to roll out, and they're, to be honest, more demanding than the stage 1 requirements. Stage 1 was sort of, welcome to EHR, you know, you've got to use it meaningfully in a few ways. Stage 2 is much more involved and starts to build on that HIE, that's Health Information Exchange. And interoperability is a growing part of meaningful use, and it's really an attempt to build a national HIT infrastructure. So those elements are becoming more important. So that's, I think it's going to be a challenge for some providers to meet those standards, so it's good to get a jump on it. We have regular webinars at ForMed Approved, and we had one recently with a top expert in meaningful use who does a lot of auditing work, and he told us that you really need to plan ahead to get ready for stage 2. And in fact, CMS has set a different reporting requirement for stage 2, where in 2014 all practices will only report on a 90-day period. And the reason why is that stage 2 is somewhat more demanding. The EHR vendors are taking some time to roll out their updates, and so to kind of cut people a break, CMS has said that you only have to report on a 90-day period. But in any case, the question regarding EHR management, I don't want to get too far afield, and so the course that's probably best suited for you would be the CENP EHR project management course, because it's really going to give you a full understanding of how the EHR works, what you need to do to get buy-in from clinicians, because sometimes, you know, it's not always easy to change the way that people work. They naturally can be skeptical at first, but it helps you work through that process. Any other questions from our audience? All right, well, as I said before, you can contact your FMA membership, or your representatives rather, and they'll pass on any questions if you have them, and we'll follow up with written answers to these questions. Cindy, would you like to add anything to what we've talked about today?
Yes, thank you so much. I do want to just thank everyone who has participated in this today, and I think Brian did a great job explaining all the different options, and hopefully you all found that very helpful and will take advantage of these offerings as we're moving into this this new area. And again, just to reiterate, if you all have any questions whatsoever, please don't hesitate to contact us at the information they've provided, and we'll be happy to assist you in any way that we can.
Well, thank you, everyone. We're going to sign off.
Thank you very much for...
No, thank you, Cindy. Thank you for having us, and it was a real honor to be able to bring these programs to your members' attention.
Well, thank you. I appreciate it very much.
All right, everyone, have a great day.